Welcome everyone to this webinar. My name is Annette, Holman, and I'm a Programme Manager at Neighbourly Lab. Neighbourly Lab's a non-profit organisation with a mission to find new ways for people to better connect. We believe that connected communities are strong communities where people can access the support and care they need to flourish and participate. Our focus is on modifying environments and providing tools to enable more social connectedness to occur. We also help public service organisations to serve everybody in that area equitably and inclusively, so all people can have opportunities to thrive in their local place. And we do this through research, innovation, training, and sharing evidence around what works. We're very thankful for the Tackling Loneliness Hub for hosting us today, a community of professionals working on loneliness. And Neighbourly Lab is fortunate enough to host this hub alongside Sheffield Hallam University and the Campaign to End Loneliness on behalf of DCMS. If you're not yet a member, then please do sign up and join the conversation. So why are we here? This week's seen the World Health Organisation's Commission on Social Connection release its landmark report, a powerful evidence-based reminder that loneliness and social disconnection are global public health challenges and not just personal struggles. The report sets out recommendations to build more connected societies, from embedding social connection into urban planning and health systems to addressing stigma and investing in measurement and research. It also strengthens the case for actions across sectors, systems, and borders. And that sets us in nicely for today's webinar. We'll be sharing insights from a 2-year programme and working with supermarkets and convenience stores to understand what role they can play in social connection and supporting community health and wellbeing. A real example of working across sectors to support this mission. We want to first thank the National Lottery Community Fund for funding this work as part of their big Bringing People Together fund. And so why shops? Well, at Neighbourly Lab, we've been fascinated about their role as a convener of people in their everyday places and spaces, and believe that more could be done to foster social connection between them and the community that they serve. I'll shortly take you through information about the trials and models that we've been developing as part of this programme. Firstly, I want to hand over to Caroline Lee, Senior Research Associate at Cambridge Public Health, who has been a brilliant academic partner on the programme and will provide us with some context. Caroline, over to you.
Thank you. So, hi, I'm Caroline Lee and I work at the University of Cambridge. And I've been supporting Neighbourly Lab on this project, having been thinking about the role of supermarkets in supporting communities for a while now, including how they might address loneliness and support older adults, for example. So this project was very much responding to the prevention agenda, which of course has long been supported by public health teams across the country. And this is vitally important against a backdrop of major inequalities in health outcomes, as shown in the map on the left, which represents spatial differences in healthy life expectancy. Some groups are at a disadvantage, a particular disadvantage, in terms of awareness and access to health and wellbeing support that might reduce the impact of structural inequalities due to things like a lack of knowledge on what services are available, limited understanding about health, related information, or not seeing themselves as needing support, stigma and/or cultural beliefs discouraging help seeking, or trust concerns around formal support settings, or even just a lack of time, poor physical accessibility, and transport costs. One aspect of prevention that can overcome some of these is social connection. And the importance of connected communities is emphasised as a protective factor for health, building resilience through mobilisation of local resources via networks and social relationships to address challenges like poverty and isolation and to cope in times of crisis. The map on the right provides a visual of the community needs score, which indicates the distribution of social infrastructure in the UK. And the deepest red on this map indicates those areas with the greatest deficit of such places and opportunities to connect. And it's not difficult to see that areas with low life expectancy also tend to be considered as high in terms of community need. So the focus on increasing opportunities for preventive health work and addressing barriers to access through improved infrastructure for support is therefore a key area of action, particularly in areas with poor health outcomes. One key approach to prevention in recent years is, of course, an asset-based approach. connection, particularly in areas with poor health outcomes. And one key approach to prevention in recent years is, of course, an asset-based approach. Have the next slide, please. Thank you. So mobilising resources and facilities of key organisations across sectors is key to this, as well as the skills and knowledge of people, the friendships and relational infrastructure, and of course, physical space and environment. And while statutory and voluntary community, social enterprise and faith sector began working together on these agendas a while ago, the role of business within this hadn't really been considered. However, particularly in a context of lean fiscal times, loss of social infrastructure and barriers to support, there's an argument for looking outside of traditional place partnerships to engage and mobilise additional partners and assets to support population and health and wellbeing goals. So due to their ubiquity and well-established community programmes, supermarkets became a focus for my research in recent years. And this slide illustrates a typology some of you will recognise, which is a typical supermarket actions around health and wellbeing and community programmes. And this was developed with a colleague of mine, Catherine Hammond, in our previous studies. And alongside this, we've got a few images that illustrate the kind of things that are involved in supermarket community programmes. But through this research, we found that in terms of engagement with local asset-based ways of working and addressing drivers of health inequalities, we found that there was unsurprisingly, little involvement by supermarkets in place partnerships, although there was quite a lot of one-to-one relationships and connections with individual community organisations. Nevertheless, we saw that there was opportunities in sticking with the potential to be more responsive to place. And the community teams that we worked with from supermarket businesses we were in contact with through our studies were also interested to engage on this topic. And so really we wanted to move from the research to be part of building a space for discussion and developing practical tools to support collaboration and identifying shared value for all parties. And as well as this project with Neighbourly Lab, I'm supporting this work here, I've also been involved in focusing on developing tools and guidance to improve supermarket responsiveness to local food security and how to better support place-based food partnerships. So if we could provide space for discussion and tools, we felt it would in turn encourage more spreading of successful approaches and buy-in by businesses who have such a widespread presence in communities. But this also required some theoretical thinking to go alongside to find out what it is that might work, the underpinning mechanisms, how and why, and for who. So we had a theory of change for our work previously, which focused on the different types of assets which were part of community programmes, but Neighbourly Lab had some fun to test ideas in practice. And the AIR idea picked up particularly on the potential of spaces, and not only in supermarkets, but also small shops. And this was the theory of change that accompanied the rationale for the trials that they've been doing. So you can see at the top the key context for the focus on stores and supermarkets, being accessing services and social connection. And then this is followed by the opportunities and potential mechanisms available in mobilising shops towards these goals, which for the big stores and supermarkets on the left-hand side was identified as being via underutilised spaces with high footfall that were highly accessible and available across many neighbourhoods and localities. And on the right side with convenience stores, which had a regular shoppers and a presence across all types of neighbourhoods, and especially in even small geographies. So the areas of activity deemed potentially impactful focused on the repurposing of those spaces for service access and social connection, and improving accessibility of first-line support by providing information on local support and connection opportunities. And I won't go into detail on the rest of the slides, as you'll be able to pore over these later when the report comes out, which I think is maybe happening right now. So that was a theory, and then came the practice, of course, and Annette Holman from Neighbourly Lab is now going to share an overview of the different trials supported throughout this project.
Thank you, Caroline, and everyone else for being here. It's obviously so many faces and names we kind of recognise on the webinar. So it's great after a couple of years of kind of research and trials to be able to share this insight with all of you. So I'm just going to give a bit more background of actually what we kind of did with our trials. We did a lot of work in our research when we awarded the funding from the National Lottery Community Fund to find out what we wanted to do, and that gave us kind of some scope to kind of think of what are the trials, what can we do, and how can we take some of these lessons to share with you. So we ended up working in trials in a few different locations across the UK, from kind of Glasgow, Birmingham and Sheffield, and also then in North and West Bristol and the London Borough of Redbridge. And that kind of trials lasted around kind of a year, and average kind of 3 to 6 months in kind of each place where we worked. So I'll just kind of take you through what we kind of did in each of those kind of places before we kind of go through what we found. So the first place we ended up working with was in Maryhill in Glasgow, which is an area of high levels of income and employment deprivation, and really has kind of challenges related to kind of health, education and access to services. So really key kind of area to kind of look at, as kind of Caroline highlighted earlier, the importance of social connection in those spaces. And we were able to, with the great kind of support with ASDA and ASDA kind of community fund, to work with an ASDA store there, which was a kind of store in a closed off kind of community. And they had this space that was a great kind of asset, an area which was a cafe, which hadn't opened since COVID times, but a space that was crying out for something to kind of be happening. And we also worked with a Tesco there, a large supermarket there off the kind of main road, so a big kind of through there of people. And they had a huge kind of open foyer space. So it was great to try different types of spaces in supermarkets to see what could happen. And we work with different stakeholders in each of these locations, and the key ones around our work in Glasgow, really community champions in each of those stores. So we worked with Ryan and Amanda, and having colleagues on the ground, colleagues Ian and Gina. And we worked with local charities, local voluntary organisations in each place, such as Glasgow Chest, Heart and Stroke and Glasgow Golden Generations, to run different sessions within these spaces. Ran them on a regular basis, and you can see on the pictures on the right. So activities such as health awareness, a health kind of a blood check, which is very popular between both kind of customers and staff itself. Brew, biscuit and blether sessions, so kind of coffee pop-ups, and put that all to kind of a community timetable, so people in the community could know when things were kind of happening on a regular basis, so they knew a place to come as part of their regular everyday shopping, where they'll be able to either access further information, gain some support, or connect with people in their visit. We then moved on to also kind of work in Birmingham. We worked in Small Heath in Birmingham, which is another area of kind of high levels of deprivation and low unemployment there. So had kind of challenges around kind of income and access to services. And we worked with an ASDA store there, which was kind of in a retail park area. And they had this real opportunity of space at the front of the store, which was an optician's that had just closed. So it was actually a great opportunity of space to transform the space, which kind of looked ugly at the time because it had just been left empty, into something that was useful for the community, literally as you enter the store. So we were able to kind of take that space over to run some trials. And that was made possible by the community champion there, Tracy, our local colleagues on the ground, Ricky, but then also developing relationships with partners locally, so through kind of local charities, through the citizens advice colleagues, through different social enterprises, NHS partners, and also the residents have been key part of all of this trials, where we kind of stopped to ask them, what do you want to see, what kind of activities would you like to see, or what kind of support would you like to see within these spaces. So within Birmingham, we managed to run a range of different kind of trials in this space on a couple of days a week. So we ran, as the picture kind of shows, a great kind of CV and job support advice. So people were really kind of thankful of a space that they could go in, a place they felt kind of comfortable to find some information and kind of support with their kind of job and employment. There were some kind of more health and well-being sessions around kind of chair yoga, healthy eating. And also there's kind of times just to kind of have a sit down and a coffee and give people a seat in the supermarket to enable that kind of conversation to flow. So making the space as attractive as possible, putting kind of chairs and tables in there. As you see, this kind of community chalkboard that we kind of put up, just to kind of invite people into the space in their everyday shopping environment. And we also then worked with Sheffield as well. We had kind of 2 stores in Sheffield that our colleagues at ASDA introduced us to, some great community champions there who were keen to do some work in their spaces. So around the Drakehurst area and the Handsworth area, one being a kind of in a retail park, but they had actually an existing community room. And some supermarkets do have these community rooms as assets. And we wanted to test how that could kind of be utilised further. And also Handsworth had an existing cafe. Great kind of spaces that are already in supermarkets, but maybe closed at a certain time, and spaces that communities could use at different times. So we worked with the champions there, Liam and Bethany, local community groups, to see what they could use and utilise in that kind of spaces, the voluntary sector, different kind of council community teams as well, who really saw the opportunity of finding people in the spaces that would be useful for them, as well as NHS teams and local police, for example, who saw that kind of opportunity of being in a space. And different sessions that kind of we tried there, from a local photography exhibition to kind of showcase the beautiful community room that they had to the residents, to NHS training courses within kind of closed rooms, but in a place that people felt comfortable and it could easily access, to gain that kind of support and connection. Also things like after school kids activities and health awareness information sessions as well. So there were our kind of 3 trials when we looked at supermarkets and really looked at the space and what could be possible and what learnings we could take from that. We also, on the other side of the theory of change that Caroline shared, we wanted to look at the role of convenience stores and really believe there was something around the convenience stores kind of connection in kind of local communities and high streets. They don't have the space per se that a supermarket has, but what they have is that kind of regular visit, that regular kind of connection, and also reaching people in the community that maybe are not attending events so far, that maybe don't know about the community sessions or don't feel they're for them, or find actually attending a GP appointment a daunting experience. How could we actually look to reach people in a kind of new mechanism through a kind of existing social infrastructure of the different convenience stores? So we worked in North and West Bristol, and we had great partnerships there and insights from local communities and residents saying they wanted to find out more about where they could find out information of what to do. So this got us kind of thinking of like, what could that look like? So we tested a kind of simple formula of creating these kind of well-being leaflets in an area in order to kind of be distributed through convenience stores. So in North and West Bristol, we worked with some great kind of partners there, with North and West Bristol locality partnership, so an NHS kind of focused partnership with the local kind of GPs, but also with key voluntary lead organisations in the area who really knew what was going on. So Lockleys Neighbourhood Trust, Avonmouth Community Centre and Shirehampton Action, who could really find out what was going on locally in those places. And what happened there is we worked with some convenience stores, but also a couple of local cafes and even a post office to engage with residents in a place that they visit so they could find different information out. Collating these kind of leaflets was about finding who in the partnership could help support that. So from a health perspective, we had the GP who were kind of looking at the wider insights of the area and what we could kind of highlight on a monthly basis, but also what was on and how could you get the community to kind of different events that were going on and make it a regular leaflet. So it wasn't just something that was stuck on a kind of notice board and you're not quite sure how old that was, but actually something that was more kind of focused to the people who were visiting those stores. So these pictures here are just the leaflet and accompanying magnets that we had in different kind of places across North and West Bristol. And we also kind of then took that trial and ran that in the London Borough of Redbridge in the area of Hainault. And we worked with the public health team here. And the public health team were then able to kind of collate that information and bring that kind of connection through the preventative work they were looking at doing and collate that together. And we could kind of then distribute through 3 great convenience stores that we worked with in that kind of local area as well. So really seeing that opportunity as a touch point in the community and how they could distribute information through their everyday conversations with residents that they were having and what that kind of learning was. So that's just a kind of quick overview of the trials that we did. What we'll kind of take you in now is how we're then kind of taking those learnings from what we did in our kind of trials into to kind of key considerations and then into suggested models. So I'm going to pass back to Caroline just to talk you through the next bit.
Thanks, Annette. So just quickly, really, what you'll probably have picked up on from those descriptions of the trials is that there are a number of different factors which really influence what's possible and how space might be mobilised for who and to what end. It's really important in terms of supporting potential to grow or expand these kind of initiatives that we found a way to balance and articulate the complexity and the very real operational challenges that exist, which we're probably not going into too much in the presentation, but we might in quick Q&A, with really some pragmatism to help get things going and to support local partners in thinking about what kind of space might be useful in their area and for what purpose. So essentially there's kind of 5 interrelated factors that shaped our hypotheses and then guided the mechanisms tested, and then really sort of led into sort of the development of the kind of the models that we'll talk about in a moment. So next slide, please. So we should be sort of thinking really about the store as not just a shop, but as a daily touch point with local people. And the more that we understand their routines and the pressures, and the more relevant the community support that might be offered within that place. So part of this is already bread and butter for place partners thinking about local priorities and key challenges, community engagement, and building networks of support for organisations. But in thinking about the potential type of activities to run in shops, we also need to reflect on which are the key stores in an area in terms of the locality and who's using those stores, when, and for what purpose. Is there potential or desire for people to dwell or to pick up information during the course of a visit? So it's really about thinking about the local context, local needs, considering the store usage and the store catchment, and who are the sort of the main sort of demographic, what's the demographics of that area? Who are the people and organisations that are existing in the area, and who might be able to tap in and use those resources if there's an opportunity. And then in terms of making it happen, it needs to take stock of the different usable spaces, obviously, in those key stores, whether they're big stores or small places, and in terms of what kind of focus of activity could work in there. So obviously on the slide there, we've kind of got a picture of an example big box store. So you might have a foyer in that store, you might have a cafe, you might have a community room. There might be a closed cafe, maybe that's an empty sort of meanwhile space that could be repurposed for something else. Or you might just have some wall space within those areas. So obviously that goes back to sort of the local context again, but it also needs to take account of the business operating environment. And the key to sort of really getting things going is adaptability to that and finding a synergy between the commercial and the community interests. And that's kind of one of the ways that we've thought about overcoming some of the challenges that can be encountered in trying to get things going in commercial spaces. So these are the kind of factors here, obviously the spaces, what are the kind of activities and how might they align between business goals and the communities in those areas, the kind of key populations in there. And then the business operating environment, and if you can find a sort of shared value, that's an ideal space to be thinking about. So, but what might these kind of things look like? So Annette's going to go on to describe the set of models that we've come up with to try and sort of simplify and find that kind of nice balance between the complexity and articulating a way to go forward.
Thank you. So yes, lots of trials, lots of research, lots of conversations, lots of lessons. Yes, challenges that we needed to kind of look at to overcome and to kind of address with working with kind of businesses as well. So what we've tried to do is come up with 4 different kind of models that could be utilized within different kind of shop spaces and places that both kind of public sector and voluntary sector kind of teams could look to kind of utilize to amplify the work that you're kind of already kind of doing in kind of places, but also that kind of the model that a supermarket or a convenience store could kind of look to engage with. And it will need aspects of both parties to kind of engage with that. But there's kind of 5 different models that we've thought that kind of possible, and I'll go through each one just to give you kind of a little kind of example of what that may be and who may kind of need to be involved in those. So the first model we're kind of seeing and called is kind of a local links corner, and this really has come from our trials in the convenience stores that I was talking about, and where we really have identified from our trials that kind of role that local kind of stores, convenience stores, but also local cafes, post offices, could be hairdressers, could whatever on the kind of street, really have a role and an opportunity of kind of helping local communities access and reach the support that they need, and helping kind of public sector and voluntary sector with their kind of ambition of what they're trying to do. So this model is about kind of raising awareness and celebrates that kind of everyday kind of role that convenience stores have in their kind of communities, and seeing it as a real kind of mechanism of being able to share information to people in a trusted space, in a place that people go on an everyday kind of basis, and seeing as a kind of more preventative social prescribing kind of model. How do you get to the people before they need to come to their kind of GP or look at that? So preventative kind of aspect. So as I say, really for kind of thinking of public sector teams is a real kind of area where this can kind of lie. So those looking and focusing on health and well-being, trying to reach kind of different residents, trying to look at a kind of health message that you're trying to get to people, and seeing how they can kind of work with these kind of organizations. So the examples in practice that I've kind of mentioned, this was, for example, when I talked about Redbridge, working with the convenience stores, engaging and developing relationships with the convenience stores so they can be your kind of mechanism of developing that change. And that takes some conversation, and it takes the development of a relationship of someone on the ground, because our learning is actually convenience stores are not going to be ones who are kind of online all the time. What they're going to be is ones who are upfront serving customers, so going in person, building up that kind of engagement with your kind of community teams, and sharing what's kind of going on will really help that kind of take place. And say, not just the role of convenience stores. We had some great examples of local cafes with when we were kind of in Lockleys, a cafe who was sharing information about the local community hub that then enabled more people to kind of then know about the community hub and feel it was for them, and attend when they hadn't known about it before. So having those kind of areas in the community that could be that kind of signpost. But to flag, they are very busy. They're very busy businesses. They're very busy with what they do. So how can you make it as easy as possible with your messaging and your avenue and your maybe leaflets that you're kind of creating, to enable them to be able to support the community as well as doing their kind of everyday job. So that's one of the models that we are suggesting. The second one kind of builds on that, but also takes in the kind of the area of kind of supermarkets as well, which is the concept of a marketplace. And this is also about making accessing communities, getting them kind of access and reach the support that they need. And this is where actual people will be there versus via kind of information leaflets or digital means. So public sector, voluntary organisations in place, sharing kind of insights, sharing information to people, or doing kind of basic things like the health checks, financial kind of guidance. So seen as a kind of pop-up style event. This does happen ad hoc in different kind of places already. Feels it could be a much bigger kind of model that could be utilised both in supermarket spaces, in very small areas, maybe where you will see fundraisers, for example, in store, but how can you kind of have a regular basis on health kind of support or information. And if it was kind of maybe as I say, we've seen that example of small spaces, which I gave the example of chest, heart and stroke, doing those kind of pop-ups, but also in large spaces where you could actually have a range of organisations. So an example here is the community-led support team in adults, health and housing, and Thurrock Council developed a relationship with their local Morrisons and run a monthly talking shops session where a range of organisations come together, from kind of awareness as well as housing kind of offices and things in a place where people regularly go. So it could be used in different spaces, could also be used in a convenience store model with a very small space. But there's a kind of another angle of how an in-person connection in those spaces can kind of help. Our third model is what we call a talk and support space. So this is about increasing all the sense of support and kind of connection at the same time. And this really comes from some of our kind of insights of working in the private spaces in supermarkets, where many have community rooms or may have a room that's suitable, but it isn't kind of either advertised or kind of scheduled. So private supermarket space that can be kind of behind kind of closed doors, which is still needed in areas, could be offered free of charge for public sector and voluntary groups. Running things like training, running kind of private kind of meeting sessions, but just doing it in a place that people can access much easier. And looking at seeing what kind of events and things that the voluntary and public sector may be offering. Is that something that a supermarket space could offer for you as well? And for those kind of attending, offering a kind of perceived, accessible, safe, free of stigma place that they can access, as well as where in many areas challenges of closing community spaces and rooms are. How could this be another kind of option? So the example I mentioned earlier, there was an NHS team that booked out a community room and one of the stores in Sheffield, and that enabled parents and their young children a space to kind of connect in a place that they could easily access, easily kind of drive to, and also do their shopping either before or after. The fourth one is called living and learning, and this is again looking at increasing the sense of community and social connection. And this really highlights the use of the underutilized spaces we're finding in supermarkets now. So we trialed in a few of those cafes that unfortunately have closed, maybe since COVID, or concession stores that have moved or kind of changed. We're finding more and more there's kind of empty spaces or meanwhile spaces in different stores. But what could happen there is actually kind of theme sessions that are kind of run by either voluntary or public sector organisations that are part of an existing remit of running different sessions. Maybe that's coffee mornings, that might be gentle exercise classes, that could be community learning events. They will need the space kind of in store, but actually can be utilised with what could be a great kind of community timetable within kind of supermarkets. So an example being kind of a wellbeing Wednesday kind of session, where actually every Wednesday something is happening in store, which gives all the kind of customers and residents a kind of focus of knowing that something is in store that they can also access on a regular basis and be part of their regular timetable. So see that as a really great kind of opportunity. And the examples we had in Asda, we did a range of these ones in Birmingham, where we ran different sessions such as slow cooking demonstrations, learn people how to kind of use a slow cooker, what ingredients they could use, how to look at healthy eating menus, doing kind of different craft sessions, and even doing, say, some chair yoga that both customers and also kind of staff found as a really beneficial activity that they had in their store. So lots of kind of examples of what that could look like. And then the final model, we recognise that supermarkets don't have lots of kind of resource or time to put to this. They have the space, but what a lot of them do have is some great community champions. And we still feel a role that a community champion could take on within their supermarkets to give them more of a kind of space and a face of the supermarket. A lot of the time they do some great work outside. So actually running kind of different reliable light touch engagement sessions in different spaces is a nice kind of opportunity of doing that and showing some kind of good back to the kind of customers and looking at social value that the supermarket is offering. So different activities, whether they're kind of things within a box, you can get everything out of a box that you kind of need. So whether that's kind of arts, crafts, painting, a coffee morning, something like that, but actually really kind of addressing needs of a local area that supermarkets have the data on. How can you kind of address that issues maybe of isolation and loneliness and run sessions there, or is there something that's not there for kind of young people, and to look to kind of respond to that. So onus on the supermarkets kind of teams and stuff here, but some nice examples again that, so in Asda and Handsworth, the community champion there really recognised that there was a lack of after school kind of provision for young kids in the area. So she set up some kind of engaging activities for the local kids and parents in a cafe that was actually at closing time, so it was a space that was empty, and was able to kind of bring people together and allow parents to connect as well as kind of kids to connect through an activity. And what she did was use actually existing resources that many supermarkets have from their charity partnerships and campaigns. For example, I know Asda have Children in Need activities, for example, also great things from BBC's Tiny Apple People that could be utilised in these kind of things. So that's our kind of final model that we've kind of suggested that could be utilised and kind of brought together and run within kind of supermarkets. So what we're doing is kind of putting those kind of model suggestions out. That we have a report that will be shared shortly that kind of covers this, and we're also looking at kind of insights of how we share this with supermarkets and shops themselves, of what their role could be. But to kind of summarize, I guess, our recommendations from this kind of piece of work, we've got kind of 5 recommendations here, thinking from a public and voluntary sector point of view. So first of all, identifying which of the local kind of shops and supermarkets have the best potential locally to you for engaging the priority communities, really thinking back to what Caroline says of the local context, what is kind of needed and where can you kind of go. And the building relationships in person is something that we've really found has been valuable in the work we're kind of doing. Who are those locally who can kind of connect, who are kind of people on the ground, and do you have the community connector role or similar within your area? Building those relationships with community champions within their kind of supermarkets, the store managers who are a key kind of buy-in, or the kind of store owners and those that are working in those kind of local stores. So you're kind of part of that conversation. So that's our first recommendation. Secondly is really looking then at the space. What is the space that there is there? What is the possibility? And what can any of those spaces offer you for the work that you're doing to think of supporting your objectives? So is that kind of store got that meanwhile space that actually you think, great, I could bring my kind of coffee morning here on a regular basis, or my kind of cooking session, or whatever that kind of may be. So balancing those kind of things of what's possible in a space. Thirdly is around sharing your understanding of the local needs with the kind of the shops and supermarket kind of staff. They may also have kind of insights as well, but really how can you kind of come together on a level kind of playing field? How are you kind of offering something that is supporting their kind of customers and the residents, and also their staff? Because actually most of the staff, especially all these shops, are local residents as well, and must be a key kind of consideration for any of this kind of work. Our fourth recommendation is around identifying existing organisations and opportunities that could offer outreach activities in those kind of spaces, or as information in those kind of leaflets, what's already going on that you kind of may know that the supermarkets and the shops kind of don't, and how can you kind of help bring that information together in a succinct way. And finally, really including those kind of working within kind of shops within as kind of stakeholders. The private sector is kind of key for kind of helping support the kind of the role and mission around social connection, and kind of to take a kind of more of a step up. So seeing them as a kind of person around the table and bringing them on board with some of those kind of conversations is our final recommendation of part of this. So that's a lot of information from all of us, but all of that information is also stored within our new report that we have just come out. So you can kind of go and revisit that and pick up any of the kind of things we've talked about today. So called Understanding the Role Shops and Supermarkets Can Play in Supporting Community Health and Wellbeing. So it's an insights report more for kind of local services that talks about all the information that we have today, that I am just going to put on as a link, and you will be the first to access it. We'll be putting this out on kind of LinkedIn and everything today. So the report has just kind of been launched, so do go away and have a kind of look at what you think of that. Also today we've kind of put together a more of a kind of how-to guide, especially looking at working with convenience stores and local kind of shops, because we really see that as an area that public health specifically could be looking at. So along with that, there's also a guide for local to kind of work with local businesses and organisations and kind of more of a step-by-step guide of how you could look to do some of that trials that we did with the kind of local convenience stores. So that is also a report that we will share afterwards as well. And then following that, coming next week, we're looking at how to engage with supermarkets themselves. So some of those models I talked about do rely on supermarkets taking some kind of ownership. So we're doing a kind of specific guide as well for them of how they can kind of look to be involved in this, that will be shared next week, along with an inspiration gallery. And that's a gallery that we've actually captured some great kind of ideas and insights across not just the UK, but around the world as well, on great examples that can provide inspiration for people around what has been done in other places. How could this be kind of replicated or scaled within the relationship between shops and yourselves? And that will also be shared next week. So all of these resources we'll share with everyone on the call afterwards, and update you next week when they are coming out as well. But I will pause and stop there and have a sip of water, and I will see there's lots of kind of chat going on. So I'm going to hand back to Marnie, and I think we'll move to a Q&A.
Thank you, Annette, and well done, Annette and Caroline. It was absolutely fascinating to hear it and see it all wrapped up after a good couple of years of being out and about in store, doing all the work, setting up, exploring, building all the relationships. We've already got one question, and I'm sure to thank you for asking it, Julie, because I'm sure lots of people wonder, so how do you know it's making a difference? Do you have any evidence of the difference this has made to individuals that have gone along? For example, has it reduced social isolation and or loneliness? Annette, I'm going to throw this one over to you, because I know that the work in Scotland spent time engaging and asking residents for their feedback on it. And then to you, Caroline, if you've got anything to add. Thank you.
Yes, thank you. Yes, a really kind of key consideration that we were kind of looking at throughout these trials is how do you measure some of this, and how do we know it's kind of made a difference? And there's a lot of evidence kind of out there already that we know through opportunities of kind of social connection will support people's kind of health and well-being. So there are certain things of this kind of trial of we don't need to kind of look to measure some of that when there's so much kind of evidence about that already. What we wanted to try and capture was where people wanted to kind of engage, how many people were kind of coming, and the kind of also the opportunity for this mechanism, if you like, to take what's already existing and already has evidence behind it to a new place. And I think that's what we kind of wanted to kind of trial. So we gathered, say, insights from kind of residents and customers within the supermarkets, and insights locally with the kind of with what was happening within the convenience store kind of model, and looked to try and capture insights as we went. So within the kind of supermarkets, engaging with customers and getting them to kind of score their kind of events if they wanted to, and then within the convenience stores, rather than trying to track someone, because what we didn't have is any data to be able to take ownership of a person's journey. So that's the thing it couldn't do. And that's what one of our recommendations kind of moving forward is about future measurement. So for example, if a public health team is taking this on, or a voluntary organisation is taking this on, how can some of the data be embedded to bring this kind of connection together? How can those insights of organisations add to their data of where did you find out about this question, added to their kind of database, so you know that actually it was through that mechanism that they did, and then that kind of links to the wider kind of collection of data that people are already doing. So it's a key thing to kind of definitely be looking at, but there was definitely challenges with the mechanism of doing it, because you are a touch point and you can't follow someone's journey through. So it's relying on existing data and knowing that that connection opportunity has data and evidence behind it. I don't know if there's anything else, Caroline, you wanted to add from a...
Yeah, I mean, just to add, I think, yeah, in addition to those challenges, it's the challenge of the duration of a trial, the fact that you are the kind of the mechanism of it being a non-stigmatizing everyday kind of space, at the same time presents a challenge to measuring and engaging people in measuring the outcomes for themselves. Because, and I think there was a lot of feedback around, you know, sort of people don't want to be asking questions, they don't want to be answering questions, you know, they're actually there just to have a cup of tea and a chat, and that it's that kind of informality of some of these things that makes measuring the impact quite challenging. The other challenge around measurement of impact is most of the supermarkets, you will not be able to take new data from people once as a in the first instance in the store. So I think what the point that Annette's making about follow-up, sort of indirect, so if there's an engagement with an organisation, you kind of track back where somebody found out about you or where you first got in touch with the organisation, that might be a route towards kind of assessing somebody's contact with an organisation or support services. But I think we definitely, I mean, I noticed that some of the people in the chat were talking about activities and initiatives that they've been doing, and I think what would be great is if people could share their experiences in a moment, if we've got time there, as to whether they've been tracking any sort of impact from the activities that they've been. I know a couple of places mentioned things that they've been doing in supermarkets, so be sort of sharing their experience of being able to measure if in any way, whether formally or informally, that would be really helpful. And I think particularly anybody who's thinking of getting things going, and if you're able to get things going over a sufficient amount of time, really, yeah, think about measuring that impact, because not only is that obviously going to be useful for yourselves as an organisation, but it would also be useful in terms of the supermarket businesses, because they're around those sort of shared value points, which might be around staff well-being. It might be around customer trust of their brand, you know, those kind of things. What can be built in there, particularly if you're seeking funding from the supermarket as an organisation, so through their charitable funding or otherwise. I think those are all really important things, but evaluation is absolutely, I think, is an absolutely key thing to be thinking about, but we need to sort of understand the challenge of it being proportionate to the effort and the investment within those spaces. So yeah, I think it's a conversation we need to keep having, because it's really important. Thanks for asking that, Julie.
Yeah, agree. You're on mute, Marnie.
Every time, thank you. So there are two questions here. One's from Nick Atkins and the other from Gabby Markham, and that's looking at the convenience stores now. So did you consider using incentives to get businesses on board, particularly the smaller convenience stores, maybe a reduction in business rates? And Annette, I wonder if there's something that you could talk about how you engage with ACS and the questionnaires that you put out with convenience stores and their reactions to the ideas. And then to dovetail on that as well, there's the question around this model for convenience stores, and actually whether or not the convenience store colleagues receive support or training to signpost residents, and how we sort of leverage the mechanism of that key person within stores.
Mm-hmm. Yeah, great. Thank you, Nick, for your question. Really nice, interesting insight, because I think that's one of the things of how do you kind of bring people on board. Our insight really was how busy convenience stores are. 101 things are going on, so many different things within the kind of media, from tax raises to crime to different things that they're kind of facing. So there's many things that they wanted to kind of do, but don't just have the time and capacity to do. And what we also did as part of this was worked with the Association of Convenience Stores, who are kind of a member organisation that reach convenience stores across the country, and we were able to kind of use their kind of insight and reach different convenience stores kind of owners to get some kind of surveys that gave some kind of insight in what convenience stores would like to kind of see versus what they have kind of capacity to do. You know, and overwhelmingly, many from that, you know, would love to do more for their community. It's just what and how, but I don't have the kind of resources. There's some great individual stories of individuals doing things, but how can this become more kind of generalized? So what we actually did with this was actually we went via the location first. So we kind of set the partnerships up. So within North and West Bristol, we had the kind of partnership. So then it was about what are the stores nearby that we could engage with. So that turned as different kind of challenges. Some there were that didn't want to necessarily engage. So we kind of went with those where we built up these relationships who wanted to kind of trial something. But one thing we did try and offer, it wasn't as advanced as doing the kind of business rates, although I love that idea, was actually utilizing this leaflet and giving them space on that as a kind of area to advertise. So we offered that as a kind of, actually, you could share your message here. It could be a message that is about an offer. And we did that in Lockleys, and each month, Lockleys Cafe put that kind of local offer on that was bringing kind of customers in. But also the offer was also, you may want to tell a story about you and your own self or your family or your link to the community that actually shares some of that. So that was one of our kind of thinking points when we first did it. People still didn't necessarily have the time to actually take us up on that, but that was something we were thinking of doing. But I think it's a really, really useful kind of thinking point of how you bring them on board, given how busy they are. And as we were saying, how you need to take something literally on a plate. So here is this idea, I know you'd love to kind of help, and this is how you will do it. And then bringing on, I guess, to the second kind of question, which is actually about kind of training by kind of Gabby. That's a really interesting kind of point as well. And we found it was about different kind of levels of this, and we'll share the how-to guide we've kind of got on that has identified that there's a kind of minimum level of actually a transaction and being in a place where this information could happen, and actually that going into a store, sharing the monthly update, here's the few things that are going on. For example, this happened in Hainaut, of going in and it was saying, well, here's the local things. Did you know there's a community coffee morning literally in the community room opposite? And they didn't know that was there. So just having that conversation of knowing opposite their store every week there was a coffee morning, then just gave that kind of information that they could share. So those kind of small conversations were still key, which is why we're really highlighting the in-person point of view and not necessarily having the time to read emails or do things like that. And in our recommendations, we've also kind of put that actually there could be a deeper level of this kind of engagement, depending on where you are with your kind of teams and who might want to utilize these kind of models, which is like who is already there locally, who has got some kind of training and time on the ground, like the community connector kind of roles to go in and embed that, or also is there opportunities of adding different kind of training if the community, if the stores kind of do that. For example, mental health support training. There's a lot of kind of talk about different people within society who should have this kind of training. Why not convenience store owners? Where can they kind of be kind of supported to kind of do training and things like that? So that's kind of one of our recommendations that could happen, but just trying to balance that capacity with what they want to do and how they can help and what that kind of level is.
Great, thank you very much. We've had some activity in the chat where people are suggesting ways of measuring impact and suggesting ripple effect mapping, which is really interesting, and there's a link there, so thank you for sharing that. We've got 1 more minute for questions. Is there anything else or any comments that anybody would like to share? I can't see any hands up. No.
I'm just going to share the other report in the chat now. We'll send an email to everybody with these reports. But this is a kind of another guide that we have just kind of put out, which talks about what I just kind of said about here are the steps, what kind of things you consider, what's the kind of maybe training and the possible kind of links in order to kind of engage with those kind of local stores as well. So we'd love to hear your thoughts on any of them, and we'll put all the resources on the hub and send kind of follow-ups to everybody who has joined today. So yes, really appreciate everybody's time.
So thank you all very much for coming. Congratulations, Annette and Caroline, for a super fantastic trial, well, set of trials, and we look forward to hearing you all that you've downloaded the resources and are doing interventions in your local areas so that it can all be replicated and it's scalable and more people are reached, because they may not go to community centres, but they all pop out for a pint of milk, hopefully, so we can maybe meet them. Thank you very much indeed. Have a lovely rest of your day.
Thank you all.
Thank you all.
Thank you.